Hello, and welcome to mini number 3 for the pelvis anatomy and positioning. I will start from here, from the beginning. Let me get my little laser pointer. All right. So, the pelvis, the complete pelvis, just means a basin, and it serves as the base of the trunk and forms the connection between the vertebral column and the lower limbs. So, the pelvis itself contains 4 bones, 2 hip bones, which are called the innominate bones, 1 sacrum, and 1 coccyx. The sacrum um, forms the sacroiliac joints. So the sacrum and the coccyx and the sacroiliac joints are going to be covered in chapter 9 because they're considered part of the spine. So an AP pelvis is routinely ordered by itself or is done as part of a series. So at Miller Memorial Hospital, the series for a hip contains a pelvis. And there's also special views that we can do for a pelvis that are called the pelvic inlet and outlet, but those aren't routinely performed. They are the same technique for a pelvis, except that there is an angulation of the two, which is different for males and females, and it's performed to look for a pelvic brim fracture. And we're going to go over that in a separate whole trauma series. So, looking at the bony pelvis, here we have the 2 hip bones, which here's your iliac crest, remember? And these bones are actually called the innominate bones. The old word for them were osse coxae. We call them innominate bones. Fancy, huh? Here is your sacrum, this green triangle looking thing. This right here is your sacroiliac joints. And these tiny, tiny little bones all together form 1 coccyx. So in the pelvis, you have what is known as a false pelvis and a true pelvis. So the true pelvis is anything underneath and within the brim of the pelvis. So that would be your bladder and anything that is down below the brim of the pelvis. Now, anything that is above the false pelvis, that would include your abdomen, your intestines, all kinds of good stuff. That's in the false pelvis. Here's another picture to try and get it to where you could see that. Um, so anything within this brim is in the true pelvis. Here's what they're looking at for the inlet and outlet. We're looking for the pelvic brim fractures that can happen along here. Boop. And here's the summary of the differences between the male and the female pelvis. So for a female pelvis, you will have, so here's your pubic symphysis. And between your pubic symphysis and the ischial tuberosities, or the ischiums, you have an obtuse angle, which is greater than 90 degrees. On a male pelvis, you see how it comes up right there? It is an acute angle. Now, a male pelvis is more shallow. To me, it looks more like a little butterfly. If you can see the little white part there, it looks kind of like a butterfly. Over here, it looks much bigger. And that's to fit the baby head down for childbirth. So here's a look at x-rays for a male pelvis and versus a female pelvis. You can see here it looks more flattened, and over here it's more round. So be sure that you can name and label the parts of the pelvis. There's a blank one there. Here's the one with all the names. So this is our positioning aid. This is the iliac crest. And this is the ASIS, or the anterior superior iliac spine. The one beneath it is the inferior iliac spine. The ischium is right here. So this is the ischial tuberosity. It's just the little bony part right there. And that's actually what you sit on when you sit down. E is your pubic symphysis. F is the inferior ramus of the right pubis. So above it is going to be the superior ramus of the right pubis. Now we're going to go over the parts of the pelvic in another mini, so I'm just going over this real quick. I is your acetabulum. So the acetabulum is this entire portion right here. That's the cup that holds the hip joint, all right, or the head of the hip. The M is the ala or the wing of the right ilium, but it's called the innominate bone. So here's looking at a pelvis from the side, and they have taken out the hip. This is where the hip, the femur would be in the acetabulum. This is anterior, and this is posterior. So on the anterior portion, we have the anterior superior iliac spine, the ASIS, anterior inferior iliac spine. Up here is the iliac crest. That's our positioning aid. This is the wing or the ala of the innominate bone. And down here is what is called the body when you get closer to the acetabulum. Here on the back, we have the posterior superior iliac spine and the posterior inferior iliac spine. So in order to do an AP pelvis, we do it at 40 inches, of course. The KBP range is going to be 80 to 90. And what we're going to do is we're going to lay them on the table, or we can actually do this standing if the doctor wants it to be weight bearing. So you're going to ensure that the pelvis is not rotated for first thing. People, if they hurt, sometimes they will move and shift their pelvis. What I do is I get my hands on both iliac crests and make sure that they are in alignment. You also have to make sure that the distance from the table is the same, because if they push themselves up on one side or the other, then your pelvis is going to be off-centered. Now, we normally separate the legs and then internally rotate the legs so that the feet will come together about 15 to 20 degrees, unless you may think one of their legs is broken. And we had gone over this about how if you suspect a hip fracture, A, it might hurt, B, the foot would probably be rotated out and longer than the other leg. And that's a good idea on how you can look at your patient and take off their covers, look at the patient and see if there is a leg length discrepancy, if their knees don't line up, if the ankles are out of alignment, even by an inch, that can point you in the direction that you're looking at a hip fracture. So don't rotate in that leg. You can take the pelvis in that position and see what you're dealing with. Okay. Here's what it's going to look like. You are going to center your IRR directed midway between the level of the ASIS and the symphysis pubis. Now, we already talked about how to find the symphysis pubis without finding the symphysis pubis. The greater trochanter is right here. You can have them move their leg. You see? If she can move her legs like that, she can move her greater trochanter. I will say, though, most people can barely fit on a 14 by 17. If the IR plate at the hospital is a 17 by 17, then that should be sufficient to have your patients fit on. Just don't collimate long way or vertically. Include more of the tops of the femurs if you can, and not so much of the stomach. All right, we're mostly interested from the iliac crest down. I don't want their belly button. I don't want their lumbar spine. Okay. So here's what a pelvis is going to look like. And this looks like a fairly well-centered pelvis. Here's our iliac crests. And here's the obturator foramens. Here is the innominate bone. We have the femoral head. This is obviously a female because it's well-rounded right here. The ischial spine, you can barely see it, but it's right there, that little triangle-looking thing. And I always remember it's right behind the acetabulum. And that is it.